Hello everyone, this is Alex Sticchi on behalf of PCR Online, providing you the latest news from TCT 2023. Dear friends and PCR companion, it is a great pleasure and honor to welcome a great friend from Switzerland, Dr. Roberto Galea, interventional cardiologist and researcher at the Inselspital University of Bern, Switzerland. And we are going to talk about a very interesting trial, the one-year outcomes of the SWISS-APERO randomized clinical trial, just presented as a late-breaking clinical science at the TCT 2023 with the simultaneous publication in Circulation. The SWISS-APERO trial is the first randomized comparison between Watchman, FLX, and Amplatzer Amulet, which are currently the two most frequently used devices for the LAA closure. Roberto, thanks so much for being with us.
Thank you, Alessandro, for this great opportunity.
Great pleasure. So let's go with the interesting part. What are the study design and the main results of the one-year SWISS-APERO trial?
Great. So you summarized quite well which kind of devices we compared. So Amulet and Watchman FLX devices that are the two most frequently used devices for percutaneous LAA closure worldwide. We included in this European multi-center randomized clinical trial 221 patients with atrial fibrillation and high bleeding risk. Then we included only patients with an LA morphology suitable for both devices and without LA thrombus. We randomized these 221 patients to implant either Amulet or Watchman FLX devices, and we follow our patients with two CT, one at 45 days and the second one at 13 months. And what we observed is that, so the 45 days CT results were already presented 2 years ago at the TCT Congress, and we observed that the two devices at short term after procedure work quite similarly with a similar LA seating performance. And at this sub-study at 1 year, we observed again that the two devices achieve similar rates of LA occlusion as evaluated by CT at 1 year. So I think it's a very important message to give to the scientific community. Both devices work quite well in LA seating, and the clinical outcomes were also similar, Alessandro. We had a composite of cardiovascular death, stroke, and systemic embolism of 9.5% in the Amulet and 10.2% in the Watchman FLX, without significant difference between the two arms. So I think we can trust both devices for our procedures.
That's great. That's great also because we know how complex are these kind of patients. So it's very important to know that both the devices have the same possibility to treat very, very nicely the patients. And what can you tell us about the procedural or long-term complications and about the antithrombotic therapy you used in the trial?
That's a very important question. This procedure is a preventive procedure, LA closure. So we need to keep this procedure as safe as possible, as much safe as possible. And the late onset procedural complication typical of this procedure are the device-related thrombus and the residual leak. We observed a very low rate of device-related thrombus at 1 year in both arms, 1.2% in the Amulet group, 1.3% in the Watchman FLX group. And then a rate of peri-device leak roughly of 22-23% in both groups. About the clinical relevance of these two entities, we know quite well how their association with the thromboembolic events, but evaluated by TE, about the relationship between these findings at CT and the thromboembolic events during the follow-up, we still need the time and further studies to find this association and to better interpret what we observe during assessment. Yes.
Thank you. Thank you very much. I think this is a very important trial also because we are waiting, as you said, other trial about left atrial appendage closure for the future. We have a trial against to compare the LA closure with the anticoagulation therapy. So the future is definitely bright for this kind of procedure, and we are really interested in this trial. Thank you very much for being with us, Roberto.
Thank you again for this great opportunity.
Great pleasure. And thanks so much to everyone, and continue to follow us with the latest news from TCT 2023. Bye-bye.